I have a question for you. A patient is given morphine for severe pain. A few hours later, they develop pinpoint pupils, profound sedation, and dangerously slow breathing. So, which opioid receptor is responsible for these effects? You will learn the answer to this question after watching this video. Today, we will be talking about opioid receptors of the central nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. Opioid receptors can be divided into three major groups. There are mu, kappa, and delta receptors. Although they share a similar signaling mechanism, they produce different physiological and clinical effects. Let's look at them one by one. So, let's start from the very beginning. What exactly is an opioid receptor? Opioid receptors are G protein coupled receptors located throughout the central and peripheral nervous systems. The three classical opioid receptors are the mu receptor, also called MOR, the kappa receptor, or KOR, and the delta receptor, or DOR. For the USMLE, however, the most important receptor is definitely the mu receptor. Now, let's talk about the signaling mechanism, because this is where opioid pharmacology becomes much easier. All three classical opioid receptors are primarily coupled to GI protein, and this is a very high-yield USMLE fact. As you may remember from my previous videos, opioid receptor activation inhibits adenyl cyclase. Therefore, intracellular cyclic AMP decreases. But there are two additional mechanisms that are extremely important. First, opioid receptor activation increases potassium conductance. Potassium leaves the neuron, making the inside of the cell more negative. This causes hyperpolarization, and a hyperpolarized neuron is less excitable. Second, opioid receptor activation inhibits voltage-gated calcium channels. As a result, less calcium enters the presynaptic nerve terminal. And remember, calcium influx is essential for neurotransmitter release. So, when calcium influx decreases, neurotransmitter release decreases. The overall result is neuronal inhibition. We said that the most important receptor is mu receptor. But why? Because the mu receptor is responsible for most of the clinically important effects produced by commonly used opioid drugs, including morphine and many others. Activation of the mu receptor can produce analgesia, euphoria, sedation, respiratory depression, and meiosis. So, whenever you see a typical opioid drug in a clinical vignette, your first thought should be mu opioid receptor. So, are you wondering how to remember the mu receptor? It's simple. So, let's set up the equation then. Mu equals makes you more. The K point, mu is related mood, meiosis, major analgesia, and more breathing suppression. Now, let's move on to the kappa opioid receptor. The kappa receptor, or KOR, is also widely distributed throughout the central nervous system. Kappa receptor activation can produce analgesic effects, but it can also influence emotional states and can be associated with dysphoria and aversive responses. So, when you think about KOR, think pain modulation, stress, and affective state. So, are you wondering how to remember the kappa receptor? It's simple. So, let's set up the equation then. Kappa equals kills the joy. The K point, kappa is related kicks mood down, kills reward, and kills pain. Now, let's take a closer look at the delta opioid receptor. Compared with the mu receptor, the delta receptor is less prominent in clinical pharmacology, but it is still an important part of the endogenous opioid system. The delta receptor is also expressed throughout the nervous system and is involved in pain modulation and neuronal regulation. Delta receptor is particularly associated with the endogenous enkephalin system. So, are you wondering how to remember the delta receptor? It's simple. So, let's set up the equation then. Delta equals does delight. The K point, delta is related deals with pain and decreases neuronal activity. Let's back to our question. Patient is given morphine, develop pinpoint pupils, profound sedation, and dangerously slow breathing. So, which opioid receptor is responsible for these effects? The mu receptor is primarily responsible for the classical opioid effects, including respiratory depression, meiosis, and sedation. Activation of mu receptors in the brainstem suppresses the respiratory centers, leading to slower breathing. It also affects the pupillary control centers, causing meiosis and produces central nervous system depression, resulting in sedation. And that brings us to the end of today's topic. Now that you have mastered the core functions of opioid receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Which drug is a competitive opioid receptor antagonist that is commonly used to rapidly reverse opioid-induced respiratory depression and overdose? I will be waiting for your answers in the comments. See you later.